a guide to managing the disease and steps to take for preventing diabetes. Diabetic home testing. The three types of prediabetes are gestational, insulin resistance, and obesity. Gestational diabetes is temporary and usually goes away after pregnancy has ended. Insulin resistance is an irreversible condition that can lead to diabetes if left untreated. For the most part, prediabetes means that the blood glucose levels are higher than normal but not high enough for a diagnosis of diabetes. Prediabetes can and does turn into type 2 diabetes if you don't take care of it. Obese and overweight people are at risk for developing this type of prediabetes because their excess weight puts pressure on their pancreas, which affects how it produces insulin. A condition known as prediabetes marks the transition from normal blood sugar levels to diabetes. Diagnosing prediabetes at home is not easy because it requires frequent testing of blood sugar levels, and some patients find this inconvenient. There are also other factors that make it difficult to diagnose prediabetes at home, such as obesity, lack of physical activity, and genetic predisposition. These kits are easy to use and require only a small amount of blood for testing. Most diabetics use the device to check their blood sugar levels. The glucose meter often holds a test strip that measures the blood sugar level on one end and has a chemical called glucose oxidase on the other end. The lancets are needle-like objects that puncture your skin to collect a small drop of blood. Test strips, that go with your meters. Test strips are used to measure the amount of glucose in the blood. Lancets go inside the lancet devices that are used to extract blood from a person's finger for testing. There are two types of lancing devices, one uses a spring-loaded mechanism, and the other has a mechanism that requires squeezing. What are you looking for in blood sugar ranges for prediabetes? An 8-hour fasting blood sugar level of 99 mg/dl or lower is normal. 100 to 125 mg/dl shows you have prediabetes, and 126 mg/dl or higher shows you have diabetes. Put a test strip into your meter. This will depend upon the type of meter you have. Use the lancet when your meter says it is ready for a drop of blood. Pull back on the lancet device to cock it, and then place the tip of the device against your fingertip and press the button on the lancet. You are looking for consistency in your blood sugars.